2014-15 has been a successful year of operation as a healthcare organisation for Sutton CCG. We've built upon the strengths of the previous year, 2013-14, especially using clinical commissioning and the general practitioner role in commissioning. Our vision is to build the best affordable healthcare for Sutton, and we're doing this by working with local organisations, London Borough of Sutton, health and social care organisations, as well as of course individuals, patient representative groups, families and carers to bring about more integrated care, better care in the community and closer to patients' homes. The priorities we concentrated on this year were hospital care, out of hospital care, mental health, long-term conditions management, integration and collaboration.
I'd like to say how proud and pleased I am with the progress that Sutton Clinical Commissioning Group has made this year. The important thing is that we have managed to retain and develop our clinical commissioning through engagement with our clinicians. We have 27 practices in Sutton, all of whom are involved in the decisions that we make, divided into 3 localities, supported by locality practice managers and practice nurses who work in their own forums and provide us with more information. The second thing I'd like to mention is that we have managed to reach a financially stable position. This has not previously been particularly the case in Sutton, but has been due to a lot of hard work by a lot of people and is really important because by reaching financial stability, that's when you can start to make plans to improve the quality of healthcare for people in Sutton.
We're a group of 10 practices that look after 82,000 registered patients. We've worked together in the Sutton Engagement Scheme over the last year, managing successfully areas around dementia and the improvement of prevalence rates around COPD, and coordinating clinical care across the locality. We have a number of health challenges locally, particularly related to the care of the elderly and those in registered homes such as nursing homes and residential homes, but also in the care of circulatory and cancer care.
In Wallington we have 8 practices covering approximately 53,000 patients. One of the key areas we addressed last year was around access to primary care. The CCG commissioned a pilot where we had a new telephone appointment system which really improved the access to practices and reduced A&E demand quite significantly, and as a result we're rolling it out across other practices. Looking to the future, we are really concerned about chronic disease and the escalation in kind of the rates of chronic disease. So we are trying to do more preventative work and improving the current chronic disease pathways that we utilise to improve not only the patient experience and quality of life, but also reduce the burden on the NHS.
We have 9 practices in our locality with a little over 54,000 patients. Our patient demographics are that we have a deprived population and we have plenty of elderly patients as well as children. So it's important that we concentrate on their health needs. Last year we were looking at areas of reducing A&E attendances, emergency admission rates, looking at our outpatient referrals and having cost-effective prescribing. Next year we're going to be looking at a few different areas with a bit more innovation, especially looking at our antibiotic prescribing, supporting our deprived populations such as the elderly and children, and also reducing the prevalence of things such as dementia, respiratory health illnesses and cancer. We also want to support our GP practices at a grassroots level, especially when it comes to GP and nurse recruitment, access for the patients and our CQC inspections.
I believe that everyone here in Sutton has the right to access excellent healthcare services. But we all know that access to healthcare actually only makes up about 20% of the determinants of good mental and physical health. The other 80% is made up by the environment that you live in, your housing, your education, whether you have good recreation, leisure and cultural services in your local area. That's why it's so important that here in Sutton we continue to integrate our health and social care services, that we give everyone the opportunity to make choices and have control over their lives so that they can lead long, happy and healthy lives. If we continue to pool our resources and our finances, if we continue to develop a partnership based on trust and understanding, on joint working, then I believe we can fully integrate health and social care and provide our residents here in Sutton with those modern joined up services that they deserve in this modern world.
So we're really pleased now to be able to say that patient groups have gradually developed over the year, and all of Sutton's practices now report having some form of patient engagement. And at the patient reference group, where representatives from patient groups are able to attend, over 75% of Sutton's practices are represented regularly at the forum.
Last winter was a very challenging time for the acute services within the NHS. As commissioners, we try to help our local emergency services by not only increasing the number of GPs in the local out-of-hours service, CellDoc, but we also provided GP cover within the urgent care centre in the paediatric department in order to increase capacity at weekends during the winter period. Additionally, we work with CellDoc and the ambulance crew on the Doc in a Car initiative, where a GP was in attendance for non-life-threatening ambulance calls, and 90% of those patients that were seen by the Doc in a Car service were treated at home and didn't require transfer to hospital.
No other health condition matches mental ill health in terms of prevalence, persistence and breadth of impact. Stigma permeates through mental health and access to services can be hindered. In 2014, Sutton CCG developed a vision for a primary care mental health service, a vision to promote resilience and prevent escalation of mental ill health. All this in an environment less stigmatising and more innovative than had come before. This vision became Sutton Uplift.
So Sutton Uplift is a new service for people who live in Sutton. It provides health and wellbeing support. There are four main elements to the service. We have a wellbeing support service. This is a team of wellbeing navigators who work closely with individuals to access services in the wider local community. We have an IAP service providing both face-to-face and group psychological therapy and also online treatments, and we have a single point of referral for GPs and also for people who refer to our services. In addition, we provide primary care recovery support, working closely alongside GPs to help people manage their long-term mental health conditions better. I think together this new service provides a really innovative approach to help improve long-term mental health care for people who live in Sutton.
So we're in a good CCG that's got to a good place over the last 2 years, with an ability to provide quality services for the people of Sutton, to commission services that deliver improved performance standards, so A&E waiting time for patients as an example, and we've kept strong control of the money. So we're in a good place going forward, and now our question is how we get from good to excellent, and an example of that is the Vanguard programme. We're one of 6 areas in the country looking at how we work together to redevelop services for people who live in care homes, a very vulnerable group in our society. And we hope to draw on their experience from the other care homes and experience from elsewhere around the country to innovate what we do even more. We also have all our other priorities going forward, so services around hospital care, out of hospital care, mental health care, integration services between health and social care, and long-term conditions management as our priorities in the future. And in total, we'll be investing another £5 million in those services for the people of Sutton. So from good to great, and we're heading in the right direction, and it's an exciting time and place to be at the current point.